In order to go to your next doctor's appointment, you might want to take a mask. Don't forget your keys. Or just get a tablet. Today, we're talking about virtual doctor visits and telehealth.
And then he cabled me and said, I've got insulin, it works, come home quick.
We ran out of insulin too. Some of our patients who had been treated and were well died from lack of insulin. That was a hectic time, particularly for me because I was supposed to make it again, and of course we did rediscover how to do it, and the secret can never be lost.
So welcome back to the Type Me channel. I hope everyone is staying healthy out there, both physically and emotionally during this time of crisis. In order to reduce COVID-19 exposures, many doctors are now switching to video appointments only. So today, you'll get to see an example of what a virtual doctor visit may look like, as I have a one-on-one chat with Dr. Evale on a virtual call. Next, I'll talk to you a little bit about the telehealth system, how that works, and really what that means to us going forward as diabetics. So since the late 1800s, doctors have always found creative ways to treat needy patients in their homes. Back then, the techniques involved medical care via telephone. They even tried radios for a while. In the 1930s, roughly 40% of all doctor appointments were conducted in homes. And it was pretty commonplace to see a doctor walking through your neighborhood en route to their next house call. But by the 1950s, those numbers diminished roughly by 30%. And it's a statistic that continues to decrease even to this day. I'll bet you a whole case of TP that you've probably never even had a doctor in your home. Unless you are a doctor, or your spouse is a doctor, or your roommate is a doctor. You get what I'm saying. But during times like this, when there's a global pandemic, and people are stuck in their homes in quarantine or social distancing, this is exactly what we need. Enter the telehealth system. So what exactly is telehealth? Well, let's talk about it in the prick. So telehealth is defined as the use of electronic information and telecommunication technologies to support and promote long-distance clinical healthcare. It's essentially healthcare that doesn't require you to leave your home. Now, this service pretty much eliminates the need for most office visits, and it even allows you to fill your prescriptions without ever having to leave your lazy boy. Now, the term telehealth is really a broad term. It covers many different facets of the healthcare system, like video conferencing between patient and healthcare providers. There's remote patient monitoring and mobile health, which essentially enables providers to view your medical device statistics using mobile devices like your cell phone. A good example of that is Dexcom Clarity. For those of you that have the Dexcom system, you know what it's like. And last but not least, there's a facet called Store and Forward. This allows the electronic sharing of HIPAA-sensitive types of documents. So what exactly is a virtual doctor appointment supposed to look like? Well, you're in luck. I recently met with and recorded a visit I had with a renowned doctor, and I hope this helps give you guys a little bit of insight on what a doctor visit on a virtual call might look like. Enjoy. Hi, Mr. Evale. I'm glad that you were able to meet with me today on this telehealth call. I just wanted to record this call so that my friends on YouTube can kind of get an idea of what it's all about.
Dr. Evil, I didn't spend 6 years in evil medical school to be called Mr. Thank you very much.
Oh, my bad, Dr. Evil. I honestly, I don't know what's harder nowadays, finding a doctor who's still seeing patients in office or getting a case of TP, you know what I'm saying?
Either way, it's bad.
Yeah, so I don't know if your office filled you in or not, but I'm having some symptoms I'd like to go over with you.
Can you remind me?
Sure, I've been feeling really crummy lately, and I've got body aches. I kind of feel like I got a fever coming on, and I really hope I haven't been exposed to this corona thing.
Really?
Yeah, and plus I'm diabetic, and so that really worries me. And I'm hoping through this telehealth thing, you can actually help me refill my insulin prescription as well.
Insulin?
Yeah, insulin, and maybe some needles. I mean, by the way, what is this going to cost me?
1 billion, gajillion, fifillion, shabadoo million.
I can't afford that. That's crazy. I mean, really, who's got that kind of...
Let me tell you a little story about a man named
Well, do you at least take credit?
Even before you start, That was a preemptive shh. Just know I have a whole bag of shh with your name on it.
So long.
Okay, that didn't go well, and that was obviously a fake call. Because showing you a real virtual call would constitute a HIPAA violation. What's a HIPAA violation, you might ask? So HIPAA is an acronym. It stands for the Health Insurance Portability and Accountability Act. This was passed by Congress in 1996. The act sets a national standard to protect medical records and other personal health information. This protects patients, especially during the dawn of the virtual doctor visits, because it makes sharing our medical records and our sensitive information like video calls illegal. So traditionally, virtual health has had two major hurdles. The first one is finding the right software to use to avoid these HIPAA type violations. Now, there are currently several different software options for telehealth via mobile and PC. But what I would do personally, and I've already done, is reach out to your PCP or your endo and ask if they are looking into this option. That way you can learn the specific software that they're going to use. The second hurdle is pricing and getting the insurance companies on board to cover consumers. On Tuesday, March 17, 2020, the Trump administration and Department of Health and Human Services announced an unprecedented step to expand Americans' access to telehealth services during the COVID-19 outbreak. Additionally, the HHS Office for Civil Rights announced that it will waive potential HIPAA penalties for good faith use of telehealth during this emergency. And that's great news because this announcement pretty much eliminates hurdle number one. Additionally, the HHS Office of Inspector General provided flexibility for healthcare providers to reduce or waive beneficiary cost sharing for telehealth visits paid by federal healthcare programs like Medicaid. Now, if this catches the eye of the insurance companies attempting to stay competitive in the market, this could also eliminate the second hurdle, which is cost. So is virtual health something that you're actually going to look into? I mean, how do you feel about this whole online doctor-patient thing? Well, let's talk about our thoughts in the squeeze. Some of the most progressive and resilient people I know are diabetic. Think about it, we've been dealt a bad hand. And with all of our daily hurdles, most of us have actually become tougher individuals in spite of it. Times are changing, and our ability to transition with these changes will ultimately shape our potential outcomes. And telehealth really is just another tool in our toolbox to help us win against another bad hand, which in this case is coronavirus. So I'm urging you, take care of yourselves, adapt, overcome, and be safe. I'm Ben, I'm Type Me, and I'll see you next time.